Today, 7,096 Albertans have now recovered from COVID-19. We conducted over 6,500 new tests yesterday and identified 45 additional cases in the province. Currently, 37 people are hospitalized with COVID-19, with 6 of these in ICU. I am happy to report that there are no new deaths to report in Alberta. I want to inform the public that recently our lab identified a group of 800 samples that were collected last week but delayed in getting tested due to a transportation issue. There were 6 positive tests in this group, and the individuals who tested positive have been contacted, and contact tracing is underway. Out of an abundance of caution, a small number of those who tested negative may need to be retested if they were symptomatic. The likelihood of an inaccurate result is extremely low, but the lab will be contacting those individuals who tested negative to let them know that there was a delay in testing their sample and discuss whether or not they need another test. Today, I also want to let you know we are listing an outbreak at the Misericordia Hospital in Edmonton. This outbreak is confined to a single unit, and so far 6 patients and 2 staff have tested positive. Outbreak protocols have already been implemented, and all staff or patients who may have been exposed are being tested. We currently have 532 active cases in Alberta, with 236 of them in the Edmonton zone. I know that many are following these numbers closely. We also continue to monitor the situation closely, including adding the northeast region of Edmonton to Alberta's watch list yesterday. It's important to remember that this list is simply an indicator that health officials need to take a closer look at what is going on. We were in contact with Alberta Health Services and the City of Edmonton, and at this time, there are no additional measures that are needed. As many of you know, a number of restaurants closed in Edmonton over this past weekend, and I've had multiple people ask if Alberta Health or AHS ordered those businesses to close. We did not require closures, and to date there are no known outbreaks at these locations. As part of the guidance we have provided, all restaurants are expected to have procedures in place for rapid response if a staff member or patron develops symptoms of COVID-19. These closures were operational decisions made by the owners of these restaurants. I know that restaurants, cafes, and pubs play a significant role in our society, and that this news was concerning for some Albertans. It is an important reminder that the virus is still here. As we move forward, we will continue to see some new cases in all sectors, including the food service industry, and ongoing use of preventive measures is needed to keep this spread low. It's important to take every case seriously, but also to remember one case does not automatically require a business to close for public health reasons. It also does not mean that anyone who visited the same establishment is automatically at risk. Determining who is at risk is something that our contact tracing teams closely assess based on when the individual became symptomatic and 2 days prior to that point. Anyone at risk of exposure is immediately contacted, offered testing, and required to isolate.
I'm here today to announce another step forward in our government's response to the COVID-19 pandemic and the latest example of how this province is leading Canada and the world. Alberta is the first province in Canada to invest in serological testing, to expand our testing capacity and help us track the spread of the virus. Since day one, we've been doing everything in our power to flatten the curve and to limit the spread. And we've succeeded with the help of every Albertan and all of the dedicated people in our health system. We're now well into stage 2 of relaunching our economy and relaunching our health system. But as Dr. Hinshaw has said, the COVID virus is still with us. No region, no community, or group is immune. So we're taking a safe and measured approach. And part of that approach is distributing non-medical masks through drive-through restaurants and other partners, including municipalities, First Nations, Métis settlements, seniors organizations, and places of worship. The first 20 million masks have now been given out, or they're on their way to people who've requested them. Yesterday, we announced that we're getting ready to distribute another 20 million masks starting in July. These masks are an important tool to help slow the spread of COVID-19 throughout Alberta. Testing is even more important, and it's a cornerstone of our relaunch strategy. Alberta continues to be a world leader in testing. In fact, we've now completed more than 400,000 tests, including over 6,500 yesterday. And we're going to keep on leading Canada and the world. And that's why I'm pleased to announce today that our government is investing $10 million into targeted serology testing to help track the spread of COVID-19. Now, serology testing is different from the swab testing that is already available to every Albertan. A swab test, or also known as a PCR test, is done to see if someone currently has the virus. And these tests are essential to identify new cases so that we can trace contact, limit spread, and contain outbreaks. Because it's important to be clear, we will continue to see cases and outbreaks throughout the province. But even with the best testing system in Canada, we know that there are people who've been infected and were never tested. Many of them simply because they never got sick. And that's where serology testing comes in. It detects the presence of antibodies in a person's blood, which can show us if they've been exposed to COVID-19 in the past. And that shows us more about how the virus is spreading and how best to contain it. Serology testing is a big step forward, but we also need to be clear about what it doesn't do. It does not, and I repeat not, replace swab testing. It doesn't tell us if you're currently sick or if you're contagious. And it doesn't tell us if you're immune to COVID-19 or to what degree or for how long. This virus is new, and we just don't know how it behaves yet. We can make assumptions based on other viruses, and they may turn out to be right, but we can't base our relaunch on assumptions. We need to know how much immunity people have after they've been infected, if they can be infected again, etc. Serology testing will help us find out and contribute to the global evidence, which will help all jurisdictions moving forward. We're funding 4 voluntary public health studies which will allow researchers to closely monitor and also test a representative sample of Albertans. 2 of these studies are going to test groups of Calgary and Edmonton children for antibodies of the virus. These studies will start next month and test the children twice a year until 2022. A 3rd study will regularly test a group of Albertans over the age of 45. And finally, our labs will conduct a study which will anonymously test random samples from blood collected for other purposes across the province. These anonymous samples are going to come from every region and include anyone over the age of 18. Together, these 4 studies will give us a lot more of information about how the virus is spreading. Now, I'm proud that Alberta is the first province in Canada to take this step. It's another example of the leadership that we've shown from the beginning of the pandemic. It underlines our commitment to following the evidence, to contain the pandemic effectively, but also limit the damage to our economy and people's health and quality of life by reopening as fast as we can, but as safely as we can do it.